Hi, my name is Aatif, MD candidate class of 2023. I'm going to talk about perioperative hypothermia. So the normal core body temperature is about 36 to 38 degrees Celsius. Hypothermia is defined as anything below 35 degrees Celsius. Some of the primary methods of clinical heat loss include radiation from blood and subcutaneous vessels, convection from wind and laminar airflow in surgical suites, evaporation from the respiratory system in exposed mucosal surfaces, and conduction from direct contact with cooler objects, including the table or fluids. Some of the anesthetic effects on thermoregulation include promoting vasodilation, impairing central hypothalamic regulation on temperature, and impairing both autonomic and behavioral responses in a dose-dependent manner. So some of the complications of hypothermia include shivering, which is important to note is not always from hypothermia. It can be due to pre-existing pathology, pain, or drugs. Adverse cardiovascular events such as arrhythmia or ischemia with a 3 times increase in morbid myocardial events. Reversible coagulopathies with increased blood loss and transfusion requirements. Impaired immune function and wound healing with increased incidence of wound infection. Vasoconstriction. Physiological stress on the body, which leads to increased heart rate, blood pressure, and O2 consumption. Impaired drug metabolism, including a lot of anesthetics, and prolonged discomfort and hospital stays. So some ways to manage hypothermia perioperatively include temperature monitoring, with tympanic membrane, esophageal, and nasopharynx being the most reliable methods. Pre-warming the patient, because 90% of heat loss occurs through the skin, less heat is required to warm the body when redistribution occurs with anesthesia. Optimizing external conditions such as keeping the room warm during induction prep and draping until warming devices are applied, and tucking extremities. Warming IV fluids, especially in longer cases or when there's a lot of transfusion requirements. Thank you for listening.